Hello, welcome to our monthly care education series, a care series, Understanding Cervical Cancer. Today, we are going to discuss a topic that affects millions of women worldwide, cervical cancer. To start off, let's understand what the cervix is. The cervix is a part of the female reproductive system, and it plays a crucial role in childbirth, pregnancy, and more. Now, why is it important to talk about cervical cancer? Cervical cancer is a significant health concern, ranking as the fourth most common cancer in women globally. According to the World Health Organization, or the WHO, there is an estimated 604,000 new cases and 342,000 deaths in 2020. About 90% of the 342,000 deaths caused by cervical cancer occurred in low and middle income countries. The highest rates of cervical cancer incidence and mortality are in sub-Saharan Africa and Southeast Asia. Now, this is often related to inequalities in access to vaccination, screening, and treatment services. Risk factors including HIV, prevalence, and social and economic determinants such as sex, gender biases, and poverty. The Center for Diseases Control, or the CDC, estimates that more than 90% of all cervical cancer cases are caused directly by HPV. That would mean of the 10,000 or so people who are diagnosed each year, more than 9,000 will have cervical cancer because they were exposed to HPV. Approximately half of all cervical cancers are caused by HPV 16. Another 20% are caused by HPV 18. Other strains associated with a higher risk of developing cervical cancer are HPV 31, 33, 45, 52, and 58. Other than HPV, smoking and being chronically immunocompromised can increase your risk of developing cervical cancer. Chronic immunosuppression, such as from HIV or AIDS or other disorders of the immune system, is also associated with a higher risk of developing cervical cancer. Also, not having routine cervical cancer screening tests, such as Pap tests, can mean precancers are not found in time to prevent cancer. Some studies also suggest that oral contraceptives may increase the risk of HPV and eventually cervical cancer, but other factors may be causing that as well. Now, early detection is crucial in preventing cervical cancer. Pap tests, sometimes called Pap smears, are very important tests for finding abnormal cells on your cervix that could lead to cervical cancer. Pap tests find cell changes caused by HPV, but they don't detect HPV itself. Pap tests only take a few minutes. They shouldn't hurt, but you may feel some discomfort or pressure when your doctor or nurse performs it. If your Pap test results are abnormal, don't panic. It's completely normal to have unclear or abnormal Pap test results. You can get a Pap test at your doctor or nurse's office, a community health clinic, the health department, or your local Planned Parenthood health center. Generally, it is recommended for women to start getting Pap tests around the age of 21 and continue at regular intervals. But prevention is as important as detection, and prevention is achieved through the HPV vaccine. Children ages 11 through 12 years old should get two doses of the HPV vaccine, given 6 to 12 months apart. HPV vaccines can be given starting as early as age 9. HPV infections and cervical precancers, or abnormal cells on the cervix that can lead to cancer, have dropped since 2006, when HPV vaccines were first used in the United States. Among teen girls, infections with HPV types that cause most HPV cancers and genital warts have dropped 88%. Among young adult women, infections with HPV types that cause most HPV cancers and genital warts have dropped 81%. Among vaccinated women, the percentage of cervical precancers caused by the HPV types most often linked to cervical cancer have dropped by 40%. Unfortunately, when it starts, cervical cancer might not cause any symptoms. But as it grows, cervical cancer might cause signs and symptoms such as vaginal bleeding after intercourse, between periods or after menopause, menstrual bleeding that is heavier and lasts longer than usual, watery, bloody vaginal discharge that may be heavy and have a foul odor, or pelvic pain. But if you have any suspicions, see your doctor immediately. In conclusion, cervical cancer is a preventable and treatable disease. By staying informed, getting vaccinated, and taking proactive steps like regular screenings, we can significantly reduce the risk of cervical cancer. Remember, your health is your wealth, and thank you for joining us today, and let's continue spreading awareness about cervical cancer.